or going on pressing the government, you must employ the general practitioners for all that's happening. And I hope with this we will have a whole future of this year where the general practitioners will be part and parcel of the whole health delivery system. So with that, I'd like to thank you all very much once again. And I'd like to ask Dr. Tirunavukarasu, the AGS, to deal with you all for the time being for the training program or the information on the training for you to do COVID testing. Arasu, thank you.
Thank you, Dr. Subramaniam, MMA President, for your short and sweet speech. Okay, without much further ado, okay, we will proceed to the training first. And the reason why the training, as per the message that was sent out earlier, there are a few criteria that we need to follow and comply to in order to participate in this program. Number one, you need to register with PERKESO. If you are not a PERKESO HSP panel yet, if you are already a panel, not to worry. Okay. Number two, you must also self-declare with CCAPs. We'll run through later, one by one, run through after the training. Okay. Number three, see, when you do self-declare, there will be a checkbox where once you tick it, that implies that you are going to comply to all the regulations and the guidelines. So one of it is the swabbing. Okay, swabbing, those who are going to participate to swab must also be trained. Okay, and you must have a certificate from either JKM or BPKK. Okay, and then the other one is that you must have also registered with SIMCA, Sistem Informasi Maklumat Kesehatan Awam. Okay, we'll go through later. And then when you want to conduct the test, especially rapid test kit antigen, on that day, you must be trained by the vendor as per the guideline issued by MKKM. So that is why today, what we will do is that whoever participating today, the reason why we ask your IC number, your name in detail, so that we will generate the e-certificate for to conduct the rapid test kit antigen using SD Biosensor. As we know, there are various brands. At the moment, there are only 2 brands approved by the MDA. We just checked today morning. There is one SD Biosensor. There's one more called EcoTest, if I'm not mistaken. Okay, so whoever want to do that, the vendor have to train you. So here the training is when you conduct the RTK antigen using SD Biosensor, because I think the initial one, that's what the PERKESO is going to use. And probably later they might onboard others, yeah? Okay, so without much further ado, I would like to introduce Mr. Ken from Science Valley. He will just run through with you the practical part. Don't worry, no theory. Only the practical part, what we are supposed to do on that day. Okay, Ken, hand over to you.
Okay, thank you, Dr. Arasu. Good evening, fellow doctors. So basically, I'm here today to show you how do we perform the standard Q COVID antigen test. Okay, so before I move on to the training, just briefly introduce to you. So the kit, it's from SD Biosensor, so it's manufactured by Korea, SD Biosensor Korea. And this standard Q COVID antigen kit is actually the first being approved by WHO in the emergency use listing. And locally here, it's also approved by KKM as well as MDA. And it's also widely used in KKM hospital as well. Okay, so in this kit, you'll be receiving 25 tests. Okay, you will have 25 tests in a box. And just let me quickly show you what are the contents. Okay, so you will have individual packed strip like this of 25 strip. Okay, so it's 25 in the box. So you have 25 of each strip. The sample swab. Okay, so this sample swab is also FDA approved, provided by the manufacturer. So because it is able to, it's actually approved because it's able to collect a good quality of samples, and the swab is actually soft. So for patients, it's much comfortable. Okay. Then we have individual pack buffer tube in this seal pouch. So you can open up the pouch. Basically, it contains 25 individual buffer tube. Okay. So the manufacturer also prepared the buffer tube individually. So you do not need to mix the buffer and everything. So it's very straightforward. You just need to use this buffer to mix with your sample. Okay. Then you will have 25 filter cap. We call this filter cap because you would have to cap the buffer tube after you mix with the sample, which I will show you the process later. Okay. And finally, you will have this sticker. It's actually a sticker for you to stick the test strip window like this. You will stick this sticker over this area, all right, to prevent contamination of the strip. All right. So basically, these are the contents of the strip of the kit that you'll be receiving. Okay. So now we'll move on to the procedure of the test. So how are we going to perform the test when you receive your sample? Okay. So before you start, make sure you lay a piece of a pad so that you do not contaminate the area. And make sure to always make sure you disinfect the place before you start your work. Okay. Then you need to open up the test strip. So while waiting for the samples to come in, you can prepare the test strip. And most importantly, please label the strip and also your buffer tube. For example, you can start with the numbering or you can follow the sequential. So you can just label onto the test strip. So usually I'll write on the top part over here. Then on the buffer tube, you can just write on the buffer tube as well. So usually I will label in terms of numbering. So when your sample comes in, probably you already have a list of patients, the number of patients. So you can actually follow the sequential order so that you do not mix up your samples. Okay. So imagine I've already prepared the strip and also the buffer tube. And basically, we also have a buffer stand for you to put this buffer tube. Okay. So you will prepare the buffer, label, and the strip being labeled. And make sure after you open up the strip, remember this sticker. You just need to peel a piece of the sticker and stick on the test window here. Okay, so this is the test window, and this is where you drop your buffer. Okay, you drop your sample over here. So make sure not to close the buffer and just stick on top here. Okay, if it's not clear, you can always refer to the box. So the box will actually shows you how to do it, how to stick the sticker onto the test strip. Okay. So once I've prepared my strip, okay, for example, this is the patient sample. So basically, you will be getting the sample from the patient. Before you collect the sample, make sure you open up the seal of the buffer tube. So basically, it has a seal. You can discard this. Okay. So you take your patient sample. After taking your patient sample, you have to mix into the buffer. And while mixing, there is a certain technique you have to use for mixing the sample. Try to mix the sample slanting instead of upright. So why is it? It's because the sample swab is much longer than the content of the buffer. So if you were to mix upright, the top part of the sample swab will not be able to mix together with the buffer. So we will advise you to mix the buffer slanting. And usually we will advise you to mix for about 10 to 15 seconds. After mixing, do not remove immediately because there are still some excess that is sticking onto the what do you call it, the sample swab. So what you can do is you can squeeze the buffer tube. So our manufacturer also designed the buffer tube to be soft and easy for you to squeeze the excess. Okay, so when you squeeze the excess, after squeezing the excess of the swab, you can discard this in the biohazard bag. Okay, So because it's soft, so it's easy for you to squeeze, and because you'll be doing many samples, so your hand will not feel tired after that, because it's basically soft, and the plastic material is quite durable. It will not break apart. Okay, so after I mix my sample, I have to use this filter cap to cap onto the buffer tube. All right. So for example, if I have a few, let's say about 5 to 10 samples coming in together, so what we would advise you is to prepare the buffer tube first. So I have prepared all the buffer tube. Then once all the buffer tube is being mixed with the sample, I will have to take this buffer tube and drop exactly 3 drops onto the test window. Okay. So if let's say you have done this sample mixing with the buffer, so probably I already have like, let's say 10 buffer tubes. Okay. So when I want to move to the first one, probably it already been sitting there for quite some time. So the technique here is that you can actually squeeze it again just to mix it a little bit, or you can just shake gently, and you will drop exactly 3 drops onto the test strip. And when you drop this buffer tube onto the test strip, make sure you drop it upright. Because if you were to drop slanting, sometimes the air bubble might form inside. So the best is drop upright and exactly 3 drops. So it is recommended only 3 drops, so do not put more than 3 drops or lesser than 3 drops. Okay, so after I have dropped the buffer sample onto the test strip, I will have to wait for the incubation time. So the incubation time takes from 15 minutes to 30 minutes. All right, so for positive sample, if you have seen the line on the test strip, so basically it's the same as all rapid tests. You will have 2 lines. The first one is the control, and the second is the test line. All right. To make the test valid, the control line must be present all the time. If control line is not there, then you would have to repeat with another strip. And for the test line, to determine whether is it a positive or negative sample, you have to see the test line. If you saw a band, then it's basically positive, and if it's no band, then the test is negative. So as I mentioned earlier, the test incubation is from 15 to 30 minutes. So for positive sample, if let's say you've seen the line on the 15 minute, then you can report the sample as positive. However, as for negative sample, you would have to wait until the 30th minute, then only you read. So on the 30th minute, if there is no line, then the sample is considered as negative. Okay, so basically this is the procedure of how you are going to perform the standard Q COVID antigen test.
Thank you, Ken. Thank you for the, I think, the brief run through. So basically, this is how it will be conducted on the day. Okay. If you all have any question, you can raise your hand. You can unmute. Probably you can take a couple of questions. Okay. The other thing is that in the mass screening, of course, we may be seeing maybe 100, 200 patients here. So I think one very important thing during the conduct of the screening is that crowd control. So it is prudent that we need to prepare. That means we get the list of patients, the name of the patients first with the Excel file, and then we can number them. So that one other way, what you can do is that if you have a label, you can write on the label, and then you can tag and also stick it at the back. Okay, stick it at the back, and the numbering you can still maintain that. So on the day of the conduct, you can also talk to the HR and advise them. Probably if it's one same factory or same place, they can send batch by batch, probably by 10 by 10. Okay, so crowd control is very important because there's a very high possibility that the pickup rate could be 7 to 10%. That means what do we do if, let's say, out of the 100 you screen, 7 to 10 are positive. So you must be prepared. So you have to plan properly. You have to communicate with the whoever in charge at the factory or the plant that how are they going to arrange the area, which area you want to do. Okay, so the SOPs you have to follow very stringently. So in the event you pick up a positive case, what do you do? Because normally from my own experience, it picks up quite fast. So I personally have done more than 600 and I picked up more than 30 positive cases. So I'm just sharing my experience. So it's prudent that you plan everything properly so that the moment you pick up a positive, you isolate them from the rest. So these are the basic things over there. And then don't forget, you can bring the underpack from the clinic that we use for dressing. So what you can do on the table, for these kits, you can keep it there. So what you can do, one option is that you can place it like this. You have 4 rows, right? So you can also, for the ease, you can also arrange according to the 4 rows. Okay, then once a couple of rows, then once this one is already 30 minutes, then you can clear it. So you must have a system when you're doing that. So just be prepared. Basically, it's not difficult. It's just like how we have been doing our H1N1. Only thing, this is COVID, so we need to maintain that infection prevention control measures. So we will leave it for 5 minutes to actually to ask any questions regarding the kit itself. So if you all have any questions, you all can ask, or you all can put in the chat box. Then I can ask Ken to answer. Okay, Ken, what is the use of plastic strip over the test kit? To cover the well after finish, or to cover the control and test line?
Oh, okay. So this sticker, basically, you have to do it before you put the sample. Basically, it is used to prevent contamination and also the drying of the test strip. So it has to be done prior to testing, before you drop the buffer tube. So after you open up this test strip device, you will have to stick it immediately on the test window here, over here. Okay. So after that, then only you drop the sample in the buffer well on the test strip. Okay, another question. How long taking specimen can the specimen last? I think probably they're asking how long the specimen taken can last to do the testing. Okay, so after taking the specimen from the patient, you have to do the test within an hour. So the test validity for the sample swab, it's 1 hour. But if let's say you want to extend the validity, we actually have a certain way. You have to keep it in refrigerated temperature, which is from 2 to 8 degrees Celsius. So you can actually keep the sample in the ice pack. For that, you can have up to 4 hours of testing time. But then if, let's say, you collect the sample and mix into the buffer tube, that has to be done within an hour.
Okay, next question, Ken. What happens after 30 minutes with the result if you see 2 lines after 30 minutes?
Okay, so you have to read the results at the 30th minute. Okay, so there is a, what do you call it, a buffer time, which is plus minus of 5 minutes. So you can read maximum on the 35th minute, but whatever that is coming after that, that is considered invalid. The test will consider as invalid. But it is advisable for you to have a timer so that you can set exactly at 30 minutes. So you read the test results at exactly 30 minutes.
Okay, do we have to use biosafety cabinet? We'll go through the FAQ later by the KKM. Biosafety cabinet is encouraged, but not mandatory. Okay, if it is positive, what the next step? We'll go through later also. Okay, after taking sample, do we keep sample for a few minutes or can use straight away?
We will use the sample straight away. But as I mentioned earlier, if you want to keep this swab, basically, So usually what the KK or the KKM hospital is doing, because they have to transport the swab back to the lab to be tested, so they would have to use this sterile falcon tube, and usually they will put the sample inside the falcon tube and keep it. So that this is used if you want to prolong the validity of the sample, prolong the validity of sample. So if you store inside this falcon tube and you put in the ice pack, you can have a maximum of 4 hours before you test the sample swab.
Okay. What about drive-through? When you do drive-through, can this RTK antigen be used for drive-through methods?
Yes, basically you can do the test, but you have to have an isolated area which is not easily accessible by the public, because the test has to be done in an isolated area with a good ventilation. So try to do the test in an area whereby there is a limited walkway.
Okay. What to report if test line shows faint line within 15 to 30 minutes?
Okay, so there are certain degree of percentage of the line. So what we usually recommend is that as long as the line is visible, be it a weak or strong positive, as long as the line is visible by your naked eye, we will report the results as positive.
Okay, where can we get the kit and how much? Okay, at the moment you can get the kit from emadasia.com, which is owned by Koperasi Malaysia, Koperasi MMA, and the kit is priced at 46 ringgit. Whether you're buying 1 box or 20 boxes, it's 46 ringgit. If more doctors purchase through the platform, I believe our vendors who are here will also agree to drop the price even further. So they committed. Okay. Is there a need to do nasopharynx swab or both? In the COVID box, the cotton swab only sufficient for each, if I'm not mistaken.
Okay, so maybe I can explain that. So for COVID antigen test, the sample type is only nasopharyngeal swab. So we only getting the patient sample from the nasopharynx. So only one sample type will be used. So we will not be using any oropharyngeal swab, only the nasopharyngeal swab.
Okay. So if we got a large group of samples, do reading of the batch all at one go, divide into batches, how many in one batch is advisable?
Okay, so the number of batches would be, what do you call it? It will be subjected to every user, every operator, depending on your workflow. But averagely, what we would recommend is have a batch of 20 to 30 samples. So work on 20 to 30 samples a batch, then move on to the next batch, 20 to 30 samples. So that is based on your feasibility of how you run the samples as well. So it depends on individual.
Do we need to change the second?
Also,
Yes, Shiva.
one of the interesting question came while during our training is, what happens if the sample turn out positive after 30 minutes?
Yeah, so as I explained just now, so usually you will have a buffer time, but whatever there is more than after 30 minutes, or probably the buffer time of 5 minutes, which is 35 minutes, whatever is after that, it should be considered as invalid already. You cannot read the test results anymore. You must repeat the test. So that's why I said it is recommended for you to have a timer so that you will set exactly 30 minutes and the batch is to read exactly at 30 minutes.
Okay, there's one question. Do we need to change the second gloves for each patient? Yes, because in the event the patient sneezes on the glove, there's a possibility. So it's advisable to change the glove each time to maintain the infection prevention control and cross-contamination. Does the target tube come with the package?
So this falcon tube, it comes separately. It doesn't come together with the kit. What comes together with the kit is only the nasopharyngeal swab. So this is just an alternative if you would require to transport the sample. If not, this would not be required. That's why it is not included by the manufacturer inside the kit.
Okay. Positive cases. Okay, before that, failure rate of test kit.
Okay. For the failure rate of test kit, because we do not have a data on that, but the positivity rate we can advise because that has been done by KKM. So what KKM is seeing in terms of rapid test antigen, so far they have tested, their positivity rate is about 2 to 3%.
How many swab stick is provided per box? I think you mentioned earlier. And can we put the swab into buffer and keep it for 1 hour before we process it?
Yes, okay. So basically, after mixing the sample into a buffer tube, the manufacturer has already tested the validity of the buffer, and the sample is actually up to 24 hours. However, it is recommended by the manufacturer to test the buffer tube immediately after mixing of your sample.
Okay, what happens if it's positive? Straightforward. If it's positive, number one, of course, at the on-site, you need to isolate them first, because all the reporting you can only do when you go back to your clinic, or you can call your clinic to inform them prior to that by giving the patient's name, where they stay, and then the workplace is important. Then you do e-notification. Then for all RTK antigen, whether it's positive or negative, you must key in into the SIM card system. So it is advisable that you also print and give the report to the company as well. That carries a lot of weight. So this will be, at least as a GP, we know we are maintaining all the highest standard, unlike others. For PERKESO swab, we buy the test kit or PERKESO provide. For the PERKESO will provide. I will run through the flowchart later. Okay.
So,
yeah.
so just want to add in, the SIM card also comes with a barcode. So the chance of forgery in the testing and on the results are very slim.
Yeah. But anyway, SIM card reporting is mandatory. Just to inform everybody, whether it's positive or negative is mandatory under the guideline. Okay. Any special procedure to discard the swab and cartridge and buffer? I think the same like how you discard all the other things as well.
Into the biohazard.
Into the biohazard
bag.
Yeah. Okay. Need full PPE? Yes, you need full PPE. Okay. There are 58 messages. I think mostly. Can we get PPE set from Indonesia? At the moment, yes, but a bit expensive. We are still trying to get something cheaper. We know the market rate is anything, the full set for head cover, shoe cover, and isolation gown is around. The last time we bought was 10 ringgit, but now I think it's going around 12 to 15 ringgit. We are still trying to source out something cheaper. Do you need a special booth for collecting the samples? No. I mean, special booths, that means you provide the area. You see, when you go on site, as I mentioned earlier, you need to plan yourself first. How do you want to do it? So the flow chart, how you want to put the patient, where they wait, where you want to conduct the test, where your staff will assist you, and then where you put the biohazard, the containers, and also where do you send the patient after doing the test. If you pick up positive, what do you do? So that flow chart you need to prepare and advise the patient, the company. Okay, I think we have covered everything. Okay, now I think these are the basic things. Don't worry. We will prepare the video, and then we will also send to everyone. Okay, so now we'll move on to frequently asked questions. Okay, number one, let's look at the guidelines first. The guidelines, okay, this is actually not the guideline, KKM guideline. This one, no, this one, yes. Okay, these guidelines actually we have circulated numerous times to everybody. So Rahman, we can go through again one more time. Okay, I'll only run through what is relevant, what not relevant. Very easy, we go straight away. Okay, these FAQs were prepared by MMA. We prepared the question and gave it to KKM, and then they've answered. Okay, this is for conduct of RTK antigen. What are the criteria? This is general. I'm not talking about on-site. General criteria. What are the criteria for swabbing? Any client requested for RTK antigen testing except those considered high risk, person under investigation, or close contacts with positive COVID-19 patients. Number 2, do I need to document my patients presenting with acute respiratory infection and their swab status? Okay. Number 1, every patient that you do, you need to maintain the medical records, because this is a medical record you need to maintain. And all results need to be keyed into the SIM card system. Okay. So the next one, what should I do after swabbing? Ask the patient to wait at designated area. Proceed with the result. All results must be keyed in. Okay, at the moment, this is where the challenge is. Okay, there's only one challenge over here. That is to notify PKD and then send the leftover buffer solution to hospital's laboratory where the positive subject is referred to. MMA has already written a letter to KKM and to inform them that this particular guideline where we refer, waiting for the PKD to come and pick up the patient and also to send the buffer to the hospital is not practical at all. Okay, they have taken note and they have promised that they're going to come with a new guideline. Okay, and we also had a meeting together with PERKESO and also with the Bagian Kawalan Penyakit, Amalan, and also their surveillance team. They all have taken note of this, and then they're fully aware about that. So at the moment, I think, of course, this guideline stays. Okay, this guideline stays until further from them. Okay, next. Can I swab patients who do not meet the criteria? Okay, whenever if you have any doubt, like for example, whether on the 13th day, can you do a swab or whatever you have doubt, it's always prudent for you to contact your PKD and then ask them, tell them the history, and then can they do it or not. If the PKD says yes, you can proceed, but please make sure you document whom you spoke to, the number you called, whom you spoke to, and what instruction was given, just in case. Okay. Number 5, should I swab patients presenting with only fever? Yes, you may after having their consent as long as they are not considered high risk. Okay. I have received several queries from employers and individuals asking for asymptomatic testing for their employees. I think this one is understood. Yeah, it's the same thing. Okay, next. Okay, process of swabbing. What PPE should the doctor wear while swabbing? The doctor should wear full PPE. Okay, isolation gown, disposable apron, face shield, double glove, and N95 respirator and shoe covers. Okay, N95 respirator because sometimes the patient may sneeze, so you may have aerosolized transmission as well. Okay, what do you mean by high risk? It's already in the guideline. We'll send to you all on the high risk category. Okay, how should I set up clinic to perform the swabbing? Okay, we will share later on the self-declaration form. Okay, how should I don and doff PPE inside the GP clinic setting? Donning and doffing of PPE should be conducted at separate areas. Donning of PPE is performed at designated clean area, while doffing area is performed at designated dirty area. Separation of the area can be done using physical or administrative approaches. Okay. Next, how do I identify areas allowed to do swabbing inside the GP clinic? Can you do inside the GP clinic? Yes, you can do. So if your CCAP is going to come and ask you whether you can do or not, please show this guideline. For those under Wilayah Persekutuan, we are having a meeting with the JKWP this Wednesday at 3 o'clock. We have brought up all these issues and then we'll be highlighting to them as well. Okay. Okay. Swabbing and test procedures should be performed in a dedicated room or booth that has good ventilation. Say booth means areas. Okay, if done in a special room, you should have a mechanical ventilation exhaust fan or the light where the outflow of air from the room is away from patients and the public to a safe area. Okay, it is quite difficult to micromanage and give details in each clinic. So what you can do is that based on these, as long as you can maintain infection prevention control and if you find it's safe from the patient and you can justify your why you're doing, I think should suffice. What are the guidelines for personnel who are handling COVID-19 specimens? I think it's also in the, you can refer to Annex 8 from the KKM guideline. How should the swabs be stored and transported? If the RTK antigen test to be conducted in other facilities, swabs, like what Ken explained earlier. Okay, my patient has been swabbed. what and why should I give the patient in the interim while waiting for the results? The same thing like what we mentioned earlier. Okay. How do I dispose? It's already mentioned earlier. Okay. The conduct of the test. Is biosafety cabinet compulsory in GP clinic? Usage of biosafety cabinet equipment is highly recommended in GP clinic for RTK antigen testing. However, if the GPs are unable to procure the equipment, they may conduct the testing in compliance with the requirements stated in the guideline. Okay, so it is not mandatory. If anybody asks you, any enforcement come and ask you, please show this guideline to them, because this is from KKM. Which area in the clinic that we can set it up for swabbing and test? Swabbing and testing procedure should be performed in a dedicated room or booth with good ventilation, as mentioned earlier. Okay, training needed. Okay, a registered medical practitioner for sampling must attend and certified in the sample taking and handling training for COVID-19 for general practitioners and paramedics from private healthcare facilities issued by the Family Health Division BPPK. Okay, for RTK antigen testing, the operator must be registered medical practitioner or medical laboratory technologist who has been trained to conduct tests by the RTK antigen kit suppliers. The kit suppliers. So in this case, our kit supplier now is SD Biosensor. So he is giving a customized training to his kit that we follow. Okay. And of course, the distributor is a TRIMED. TRIMED is the one distributing. If you have any problem, if you're not getting the supplies on time, you can always contact TRIMED, especially in Rizal. He's not here, it's Rizal. Okay. Can online training by the COVID-19 antigen supplier accepted? It is recommended for hands-on training from the supplier. It's recommended. As we know, we're going to screen 79,000, 100,000 in the next 1 week. Okay, that's why we told KKM we're going to go ahead with the online training. So all those who have registered, who are attending at the moment, we have 401 participants. All of you will get the e-certificates from from TRIMED on SD Biosensor. Okay, does the kit need MDA approval or special access? All test kits, you must have MDA approval. Do not do a test that does not have MDA approval. Be aware that many kits are being sold for 30 ringgit or 35 ringgit. Please ensure, because if anything were to go wrong, they're going to come after you. Because it's a pandemic, the kit is not validated. So, because we are also communicating closely with MDA on this. Okay, at the moment, there's only 2 kits. One is SD Biosensor, the other one is EcoTest. Okay, next. Okay, this is a special access, I think, just for information. Okay, quarantine criteria. Okay, this quarantine criteria is a very, very controversial issue. Okay, a patient seen by GP in consultation room later decides to do an antigen testing. The result turns positive. Will the GP and her staff be quarantined? See, as long as you follow the strict guidelines, you are under low risk. There's no reason for you to be quarantined. Okay. So in the event, as I mentioned earlier, inform the district health office, do notification, and also what do you call it? You do SIM card reporting. Okay. Only if the infection prevention controls were not followed, then you may be quarantined. Okay. The rest of it are same. Okay, we will send you these FAQs. Please kindly go through. Please print one and keep in your clinic and be well versed with this, so that you'll be able to handle when the enforcement anybody comes to you, and you'll know that you have followed all these things. Okay, so there are a lot of questions on the chat box, because I'm the only one here. We will see whatever we can and then reply to you. Okay, the next we'll go to the PERKESO. Okay, how do we do that? Okay, the pictures. Not this, PERKESO. Okay, for the PERKESO program, there's already a garis panduan. No, PERKESO. Not this. Okay, for the PERKESO, okay, this is the flow chart. Okay, number one is that, okay, berdaftar sebagai panel HSP. If you have not registered for HSP, the email that you received today, the link is there. Okay, please go back to the link, click there. If you're not a HSP panel, then you register. If you're already HSP panel, tak perlu. Okay, and then you must also have self-declaration kepada Kementerian Kesihatan Malaysia. We'll go through later that form. Okay, then you go to log masuk e-portal sihat. Okay, then mengesahkan persetujuan untuk melaksanakan sandingan RTK antigen, and then you'll have an access ke portal PSPA bagi menguruskan pelaksanaan sandingan RTK antigen. That means even though you're a panel, you're already a PERKESO panel, you log in, then you have to sign the terms and conditions lah. Once you accept, then you'll have access. Then later you place an order for RTK antigen through the PSPA portal. Then they will give you the pembekalan RTK antigen, and then mengesahkan pembekalan melalui delivery order. Okay, then they know that you have received it. Okay, this kit is only to be used for those under that program. Okay, under the program. I know this is a bit, we did communicate. We did communicate with PERKESO earlier. Okay, basically for the charges, okay, the test kits are provided for free by PERKESO. However, for you to conduct the screening, your professional fees, your PPE, the swabbing, and interpretation and admin work is a charge. So that one, PERKESO will leave it to the GPs to decide. Okay, for the GPs to decide. So at the end of the day, bear in mind, there are 100,000 to be screened in Klang and Seremban. Okay, in 1 week, not for 1 year. It's only for 1 week. Okay, I think as far as the charges are concerned, MMA cannot decide on the charges, then with price fixing. Okay, I think we all are GPs, we should understand our value, but at the same time, we must also understand this is also a national service. Okay, it's a pandemic, so we need to be reasonable. So please decide in your own practice, how do you going to charge? Okay, so when the employer contacts you and he or she is agreeable with your charges, then they'll give you a list of names. Then probably they'll make the payment directly to you. Okay, then you go do the test. The test kit you use is from the PERKESO, for PERKESO, those contributors. Okay, that is on the part of the PERKESO. Okay, anything regarding PERKESO, you can Mr. Dr. Naharajan. Can you unmute Dr. Naharajan? Okay, we can get a few questions on this, on PERKESO part. Whatever I cannot answer, I'll write down and then I'll get to PERKESO and get back to you. Okay. How we get the kits from PERKESO, we just mentioned, follow the guideline. It is all in the paper here. Okay, this also we have already sent to everybody. Okay, we will send one more time tomorrow to all of you. Okay, what is the market rate charges for PERKESO cases? I'm not sure. Okay, we did a studies, we did collect some information. Of course, for overall charges, that means test kit plus swabbing and everything, we noticed that the charges can be anything between 80 ringgit up to 140 ringgit. So you just minus 46 ringgit, then roughly you calculate basically. I think you can also calculate based on the volume. Okay, that one we let the GPs to decide. Okay, even if you put 20 ringgit, I don't think so anybody can handle 100,000 in 7 days. So just bear in mind, you cannot deliver, you'll get a bad name. And second thing, it's just a 1 week process. And these patients, these clients can be our potential long-term clients. So I believe that all of us will go on that sense as well. Okay, but the decision is yours. Our patients know we are PERKESO selected clinic. Okay, there will be a website where the PERKESO, the employers will be given the access to look at the list of clinics. Can a company pay prior to test and claim back from PERKESO by themselves? Okay, no, this is no claiming from PERKESO. For RTK antigen, PERKESO provides the kit for free to us. So when we do the test, we are only going to charge for the professional services, admin fee or PP, whatever. The kit is free. So your charges is everything else except for the kit. So there's no claim. Can I start tomorrow with existing RTK individual kits? Okay, this one I'll just double check, because if you're going to do with RTK individual kits tomorrow, PERKESO might not pay for the kit. If you have bought 46 ringgit, PERKESO is not going to reimburse. PERKESO will only provide the kits for free. If my advice would be, if at the moment, if your kit, you just do what you have been doing all the while.
Yeah. Also,
yeah.
On that, can I just add, on our discussion with PERKESO the other day, they said you might have to put the batch number, you know. So it might be differ from what you have now and what provided by PERKESO.
Yeah. So what Dr. Siva was telling earlier is basically, you have to put the batch number in the PERKESO system. Okay. Okay, I'm not going in detail about that, because why we did discuss in the meeting, but I would allow the PERKESO to make the announcement on that part. Because at the moment, I can only mention, of course, certain things were discussed in the meeting, but I didn't see the guideline. So I will only mention what is written on the guideline over here at the moment. Unless we have already told PERKESO on certain things on the guideline, I think there will be some changes on the guideline probably tomorrow. Okay. Okay, why can't MMA come up with range of recommended price? Yes, we'll come out with a range. They have a range, we'll come out, we'll share everybody. Okay, all states have received letter from. Okay, basically at the moment, this is a targeted place. They are focusing, the first batch, they are focusing in Klang, not Klang Valley, Klang, and then Seremban, the first 100,000. The next level, they're looking at red zones in Selangor and also KL, because the whole KL is like a red zone. Okay, then they will look into the subsequent areas, because we do not know, things may change the next 1 week or 2 weeks. Things may change based on how KKM and MKN is looking at that. Okay, where to get the parafilm? Ken, you have any idea where to get the parafilm?
Actually, parafilm can be obtained by medical supplying companies, which probably I can share some later with Dr. Arasu.
Yeah. Okay, otherwise you can use some tapes to close it, the top part. Okay, is there any quota for clinic? There's no quota. It's open market. Anyway, it's only for 1 week. For Klang it's only for 1 week. Okay, can we go to the next one? Okay, the next one, okay, for those who are going to swabbing, what MMA has done, MMA has also sent conducting tests, okay, to train those for swabbing. Okay, so far we have only finished the first cohort of, not this, first cohort under 10. In the next 2 days also we are having Tuesday and Thursday also we are having another batch in KL. Okay, and then you can register there. Okay, so now I'll move quickly to, don't worry, it's going to finish here. I'll move quickly to self-declare CCAPs to conduct. Okay, all you need to do, okay, this is something also MMA pushed very hard and lobbied to get this done, because we want the process to be very seamless. Okay, basically, if you want to conduct health screening booth, you need to just declare. Okay, if you want to conduct at your clinic, also there's another form you declare. Okay, I'll go straight to the form. Go down, all the way down. Okay, I'll just run through what are the things you need to fill up. All the way down, all the way down. Okay, down. Okay, wait. Okay, here, okay, this is what you need to fill up. Nama clinic, your clinic name. Alamat clinic is your clinic address. Okay, number pendaftaran clinic is your borang B. In your borang B, there will be one long number, and last will be end with 11. Okay, that is the number you need to fill up, not your business registration and not any other numbers. Okay, that is the number you need to fill up. In nama program, you can put saringan kesihatan pekerja. Okay, so you can tick. You can just put nama program saringan kesihatan pekerja. Then you can tick what you want to do. Okay, in this case, if saringan COVID-19, you just tick saringan COVID-19. But nama program, please put that. Saringan kesihatan pekerja. Next. Okay, here, if you're going to conduct, my personal advice would be, you just tick RT-PCR, then you tick line, and then you put the RTK antigen. Okay, here you got to fill up all your names and everything, and then see here mengakui ya, menjalankan penafsiran risiko dan pengesahan bahwa aktiviti hari ini adalah berisiko rendah. Okay, this is where you need to plan properly. If you go to the place, you must plan it properly. That how do you measure all the risk assessment? That means when the patient comes in at the conduct and post testing, all these risk assessment you must conduct. You must know how to minimize any of these. That means cross infection or emergency. How do you do that? So you must have a plan for that. Okay. Next already. Okay. Okay. Here you must tick. Jadi saya juga mengesahkan bahawa saya menyediakan health screening booth bagi saringan COVID-19 serta saya mengaku dan berjanji. That means when you sign this form, is implied that you understood all these things. We cannot plead ignorant. That means mematuhi garis panduan pengurusan COVID-19 di Malaysia. You must know already. Mematuhi garis panduan for RTK antigen. What we went through just now, you must know already. Memastikan person to perform yang diketuai oleh pengawal perubatan berdaftar telah terlatih untuk menjalankan persempelan. This is where it happened. So those of you, if you are yet to do that, please kindly communicate with your state MMA, and also Dr. Siwa, can you please put the link on the group so that they can also fill up and we can communicate with our state branches to organize ASAP on this part. Okay, and then you see menggunakan test kit yang telah mendapat surat tiada halangan dari pihak berkuasa. So if anybody were to use non-registered, non-approved by MDA, if anything were to go wrong, let's assume when you are doing this testing, we are very sure the pickup rate is going to be 7 to 10%. So if we pick up using a kit is not registered, so it's going to be a big problem. So make sure that you follow everything, yeah. Okay, and also the lab is okay. Then finally, you just put your name. Okay, pemegang perlakuan pendaftaran is your certificate registration holder. You sign, not the PIC, yeah. Is the pemegang perlakuan. That's all. So you only do that. You send. Okay, then normally what will happen is that CCAPs will publish in the portal. Okay, it will publish in the portal. Okay, if let's say it doesn't appear, doesn't matter. Your proof of email of this submission is proof that you have already submitted. We have also discussed with CCAPs on that, they have accepted that. Just make sure you have scanned, you have done it, and then you have emailed, you have the copy in the event they ask you. Okay. Okay, what about doctors? Okay, how long will you get the reply after submitted? Sometimes it's 24 hours, 48 hours, sometimes a bit long. But as long as you have submitted, you have the copy, it's good enough for you to conduct the test. What about doctors that have already got SWABER certificate and registered KKM as COVID screening center? Still in the self-declared. Okay, when you conduct the test, it is by your facility. So your facility need to self-declare under the PHMSA. Can registered nurses perform this RTK antigen test kit? They may assist you, but the swabbing is by registered medical practitioner. Okay. Can the booth be mobile? Okay, when they say booth means that area is an area that you allocate. It's not to say you bring a booth and set up there. It's just basically it's just a table and a couple of chairs. That's all. Okay, how to register with SIMCA we'll run through later. Okay, Amori PERKESO panel, I think you just have to find that. We will check with the PERKESO on that. Okay, this is a self-declaration. It's very easy. So just do. We hope that more doctors will do. So we hope that at least 30% of our GPs, 8,000 GPs will actually be registered for this. Okay, the last one, we'll go to the SIMCA. Register with SIMCA system. Okay. Okay, basically, can you scroll up? Okay, this is the SIMCA system. Okay. Untuk permohonan penggunaan baru, sila emailkan permohonan user ID ke email resmi MKK. They're quite fast. They reply quite fast. Apparently, there are 600 with what do you call it? Registered with SIMCA, but then only 100 65 have self-declared. So those who have yet to self-declare, please kindly do so. Okay, please kindly do so. So the email address, so these are the information, and you can email to them. The website, you can go to Simca website, okay, and then you email to them. So once you have done the email, they'll give you notification, and then they'll give you a username and ID. Okay, normally the username, I mean the person will be the person in charge of the clinic, either the PIC or COR that you have registered. Okay, there's one question here. Would it be better to take a picture of the test kit result if it turns out positive? Yes, normally in my, what I do, we'll take a picture. We'll ask someone, not the swabber, we'll get someone to just take a picture so that we have an evidence. Okay, it's prudent to do that. Okay, so basically, this is all about the things we need to do. Number one, you register PERKESO. Okay, and then number two, you make sure you self-declare. Okay, when you submit for the new panel, we're going to submit to PERKESO, you must submit your Borang B. And then you must get the SIM card. Okay. And then the training we have already done already. So now I'll just briefly go through with the eMed Asia. Okay. Okay, basically this is eMed Asia. It's all about digitalizing private healthcare. We have seen how everybody else has taken us for a ride all this while. We have been complaining and complaining and complaining. I think it's time that we work with the solution, and with this COVID-19, let us support each other. And this platform, the majority, I mean the substantial shareholder is Koperasi MMA. Or say Koperasi MMA belongs to the members of MMA. Anybody can become members of MMA because MMA is not a syndicate of heart. It's open to everyone. Okay. Okay. Basically, what the platform has, this is actually by doctors for doctors. It has clinic appointment system. We're also finding ways how to promote all the clinics through this platform. And also we have a marketplace. Okay. And we also have the form for you to declare. The top one. Okay, a declaration form. If you need a form to declare to conduct the on-site screening or to conduct at your clinic, also you can just download and do it. Okay, go down. Okay, once you have logged in, okay, this one for you to join eMed Asia is free. As long as you're registered, you have a Borang B or Borang F, you can become a member in eMed Asia. It's free. Okay, the only thing you have to pay is when you buy something. Okay, for example, COVID-19. Okay, we do have COVID-19 antigen test kit. Okay, I would like to share something to you all. When RTK antibody first came to the market, it was 40-45 ringgit. So eMed Asia, via call, we negotiated the price to be below 30 ringgit. So at the moment we have Hilger and we also have SD Biosensor. The same distributor, 3med. 3med is a distributor for SD Biosensor. Okay, the same thing with COVID-19 here, RTK antigen. We have enough stock. So in fact, we have secured stock up to 100,000 for GPs. Okay, for GPs in the event. We are looking at this volume. We have secured 100,000 in the event non-PERKESO patients are coming for you all. Of course, if we are going to use 30,000-40,000 a month, definitely the price will drop from 46 ringgit. Okay, the distributors are here. They have assured that definitely the price will drop when the more uptake is there. Okay, next. Okay, this one. Scroll down. So the next one. Okay, yeah. Okay, this is something that we have done as part of the digitalizing process in our healthcare, especially GP practice. So we understand the pain point as a GP. I'm a GP. Okay, I understand the pain points, the challenges we have. How do we digitalize the process? Okay, so these are the things, these are the all additional features that we have, also given for free. Okay, clinic scheduling. Okay, appointment system. Okay, you even have, okay, you even have COVID-19 test certificates. These are all prepared by lawyers. Okay, you have lab. At the moment, for Klang Valley, we have a lab. For RT-PCR, we have negotiated for 120 ringgit. Okay, and then we are also onboarding 2 more labs. One lab, they are well known for their fast turnover. It's a bit expensive. We are also onboarding them. And there's one more lab. We also in the midst of onboarding them is 105 ringgit. Okay, so if more GPs are going to support this, we can bring down the test even further. At the end of the day, let us control where we spend the money. Okay. Okay, next. Okay, we even have those clinics who have registered. We have actually 1,900 facilities We have 1,600 GP clinics, 100 aesthetic clinics. We have 100 over specialist clinics. We even have 12 dental clinics and 55 ambulatory care clinics. Okay, basically, to make the life ours easy, what we have done is that those clinics you have registered here, you can have a unique link where you can send to your patient this link. When the patient opens the link, they will see all these things in the link. All they do is that it's just less than 1 minute for them to fill up these questions. Once they fill up, this will be sent to your system, the email system. All you do, the record will be there. In the event, when KKM come and audit you, where is your patient record? Where's your risk assessment? Where's your pre-assessment? It's already done. So we have made all the life easy. Okay. So I think, anything else? Yeah. Okay, these are the form. Okay, we have done, and all these things are filled up by patients and not you. All you need to do is that send them the link. They'll open the link, they'll fill up, and they'll automatically push into your e-manager system. And then you can always put it and show the KK when they come and see you. Okay, I think that is all for today. We have finished up at 9 o'clock, sorry, 9:03. I think if there are no other questions, I think if no other questions, we'll any more questions, I'll give it for five minutes. Okay, I think we had a very good turnout. Huh? We had just now I think 407 or 408. Okay. Okay, we will send whatever the things we have, we will send to you all, the copies and everything. Okay, with that, thank you very much. Stay safe, and then let's screen as much as possible. Thank you.